Do you lean forward on a shopping cart at the grocery store just to walk without pain? Does your lower back feel completely locked up in the morning, but the stiffness goes away after 20 minutes? Or does sitting at a desk shoot electrical numbness down your leg? If you check these boxes, your body is giving you precise mechanical clues. Your spine is a dynamic machine. The specific posture that triggers your pain tells us exactly which anatomical structure is broken. To understand your pain, you must understand the two weight-bearing columns of your spine. Think of your spine like a heavy door. The front of the door is supported by thick, rubbery shock absorbers called intervertebral discs. The back of the door is held together by small, bony hinges called facet joints. When you sit or bend forward, physics shifts the heavy load to the front, crushing the rubbery discs. If sitting hurts, you likely have disc degeneration. But when you stand up straight, lean backward, or twist your torso, the load shifts to the back. It grinds the bony hinges together. If standing or twisting hurts, you likely have facet joint osteoarthrosis, also known as spondyloarthrosis. There is a dangerous myth that all back pain should be treated with the same physical therapy stretches. If you search for back stretches online, you're often told to bend backward like a cobra. If you have a herniated disc, this might relieve pressure. But if your pain is caused by arthritic facet joints, bending backward will physically jam those inflamed bones together, making your pain significantly worse. Furthermore, if your back pain wakes you up in the middle of the night and does not improve when you rest, no stretch will fix it. Severe night pain is a massive red flag for spinal infections or spinal tumors, which require immediate medical intervention. You cannot accurately diagnose these conditions just by touching the skin. We must look at the internal architecture with a high-definition MRI. We check the front of the spine to see if a bulging disc is causing radicular pain, that sharp numbness shooting down a specific nerve pathway. Then we check the back of the spine. We look for enlarged, arthritic facet joints that are choking the spinal canal. This is called spinal stenosis. It causes your legs to feel heavy, weak, and painful when you walk. This is exactly why leaning forward on a shopping cart gives you instant relief. It physically opens the cramped spinal canal so the nerves can breathe. Because a damaged hinge is completely different from a crushed shock absorber, we use a strict two-step protocol. Step 1. We use the MRI to find the exact millimeter of failure. Step 2. Apply the specific intervention. If a disc is crushing the nerve, we decompress the front of the spine using advanced laser or endoscopic techniques. But if the scan proves you have severe facet joint arthritis, disc surgery will do absolutely nothing. Instead, we target the hinges. We use diagnostic facet blocks or radiofrequency ablation to safely interrupt the specific pain cables traveling from those arthritic joints to your brain. If you have been treating your back pain for months but getting no relief, you're likely treating the wrong anatomical structure. Stop guessing. Let our expert neurosurgeons review your imaging. Click the link in the description to upload your MRI or CT scans to our secure portal. Let us determine if your pain is coming from the discs, the facet joints, or a hidden condition, so we can finally prescribe the correct mechanical solution.